Morning, everyone. Thanks for staying with us. We are joined by Dr. Eugene Nowak, who is the founder and owner of Nowak Aesthetics. And he's also a board-certified dermatologist. And this is one of his patients, Janet Sanchez. Thank you both very much for being here today, first of all.
Thank you for having us.
Absolutely. So New Year's, a lot of people's resolutions is to lose weight, to start being healthier. So what you guys are here to talk to us about is a new procedure called acculift.
Yes.
So why don't you go ahead and tell us about it, what this procedure is.
Acculift is really a contouring procedure. So in people that want to look thinner, want to look smaller, want their skin to be tighter, that's really what we can do. So this is a new technology. It's using a laser fiber. And the laser is very tiny, takes a small, tiny incision into the skin, and the laser actually heats and melts the fat. So it's a wavelength, a new wavelength that's very specific. It's 8 times more specific than any other laser out there. We're going to heat and melt the fat in the area. So if someone says, boy, I've lost this area, I've lost the jawline, I want those areas to be smaller, I want them to be tighter, this is an excellent treatment for them. Minimal downtime, minimal recovery time, and they can be up and around very quickly.
Okay, yeah, so this is, instead of doing something like a facelift, which you would have a longer downtime, it would probably be more painful, this is a very good alternative to that. Yeah. So tell us a little bit about the technology behind Acculift.
Okay, as you said, this is a new procedure using laser technology. So this is something that we could never accomplish before. This laser is so specific for targeting the fat cells, it leaves the skin and the other skin structures intact. So, night and day different from a facelift where they have a big cut, a big incision, they have swelling, bruising, downtime that can go on for weeks or even longer. Here we have really, downtime that can be days to a week. People are up and around very quickly. It's done in a local anesthetic. There's no general anesthetic, no IV sedation, so it removes the risks of that. People can have something to relax them in the Valium family, but really they're up and around walking out of the procedure the same day. They're up, they go home, rest and relax. The next day they're up walking and moving. Wow.
And how long does the actual procedure take?
The procedure itself, depending on the areas that we do, can be anywhere from 30 minutes to 2 hours. Because if we're just doing a small area on the jawline, or if we're working on the neck, or if we're doing some cheek contouring for them, that'll make the procedure a little more involved. We will also include sometimes some thermage, which is a skin tightening treatment. It uses radio frequency to heat the collagen support network of the skin to help tighten the skin, leaves the surface of the skin completely intact.
Okay, so this is a safe procedure as well, right?
The procedure is very safe.
Okay.
As we said, general anesthesia is really the thing that adds the biggest risk to these types of procedure. It is local anesthetic in the areas. There's definitely a risk of a bruise in the area. There definitely can be some puffiness or swelling. There is some healing. It is a visible recovery. When we do procedures on other body areas, people can hide it with their clothes, and no one really knows they had anything done.
Right.
But this is something where there is some visible recovery. But the incision's very small. Versus a facelift where they're cut all the way along here, we're talking about an incision is about the size of a pen under the chin area, maybe a tiny little pick mark out on the jawline, but that's it.
Yeah, that's one of the hardest areas to, I think, try to lose weight from. You just have that extra skin that hangs there. Do you see the results fairly quickly?
Absolutely. Typically, if we do the procedure on a Friday, if they do the neck area, they'll have a dressing on to compress the area to reduce the risk of a bruise. We'll take that off on Monday. And right then we'll actually see visible difference. Absolutely. And
do those results last for a long period of time, or do you have to? Is it a procedure where you have to go once a year, once every couple of years?
It's a long-lasting procedure. Combining with the laser and the lipo, they're going to get years of result. The better they take care of it, as with anything, the better we take care of it, the longer it's going to last.
Right. So now, Janet, you're one of his patients. How did you hear about Acculift in the first place?
I was talking to Dr. Nowak, and I let him know that I didn't like the way my jowls looked and my chin, and I asked him if he had anything he could recommend for me. And he said there was this new procedure that would be perfect for it.
And how was your experience from start to finish? I mean, the day that you went in, how long were you in there for, and then when did you start to see the results?
Well, I went in the late morning, and I was out in the afternoon, and I didn't take a Valium. He offered that to me. It was pretty relaxed. I mean, it wasn't bad.
Right.
And then I went home that night. He did prescribe pain medicine. I didn't need it, so I didn't take it. I went to sleep, slept great, woke up in the morning. I did have to wrap my head with a white bandage to keep it compressed. And That was the worst part of it, just wearing the compression
Right.
bandage.
So are you happy with the results?
Oh yeah.
Yeah.
Oh my gosh, yes.
So I take it you would recommend it to other people, men and women, because men come and get the surgery as well, right?
Yes,
Right.
this is absolutely a procedure that men have done also. Like I said, the nice thing about this technique or procedure, it's very natural. And that's really what people are looking for this day. They don't want to look like someone else. They don't want to look like they've been in a wind tunnel.
Right.
And they don't want the scars.
Right.
I hear so many people, I mean, we have Janet's pictures here, which look great and are amazing. And we had a couple other pictures that you'll look at them and say, Janet's kind of the ideal candidate because she doesn't have a lot of loose, a lot of lax skin, needed some contouring, wanted to be thinned out in these areas. So she's pretty much the ideal person for this procedure. We have a couple other, examples here of people that had more skin, had some lax skin, but didn't want the risks of surgery, didn't want the scar, couldn't have the downtime. And like I said, this is something with minimal downtime. We can have people up and around very quickly and still get them an excellent result.
Right. Even those people who may not have been the ideal candidate, from the pictures that you were showing me, I mean, they had excellent results as well.
So someone like this would,
Right.
would not necessarily be the ideal candidate, but I mean, wow, it's just made a life-changing difference for them. I mean, that's just a huge difference there.
Right. So, Janet, you said you would definitely recommend this to other people?
I actually have recommended it. My friend really wanted to do a facelift, and I said, Joanne, you just have what I had, the neck, the jowls. You can do this, and you don't have to go through all that, and it comes out great. So it makes a big difference. It's much easier to look in the mirror.
Right.
So.
And cost-wise, is it something that's fairly affordable, or is it a really expensive procedure?
Cost-wise, compared to a facelift, it's very affordable. Depending on the number of areas, it's between $3,000 and $6,000, $7,000. If we're adding some thermage, that adds a little cost to the procedure.
Right. But overall, when you look at the acculift versus doing a facelift, the pros outweigh the cons by far.
Well, it's like I said, it's really hard to compare the two because, while the results may look the same, like I said, with minimal downtime, minimal recovery time, the pros are greatly outweigh the cons there.
So, and I also understand that you do workshops throughout the year in different locations.
Our office is located down in Chula Vista, which is just south of San Diego. We do a monthly seminar, and we actually do patient demonstrations. We like to be able to show people how easy a treatment or procedure can be done. So typically during the evening seminar, it'll be like a Tuesday evening between like 6 and 8. It's open to the public. Anyone's welcome to attend, and we'll do a treatment like we're doing a thermage treatment. So we're actually going to have a patient. We're going to do part of the thermage. We'll do half, bring the patient back out so that everyone can see that there's a visible difference and how easy it is to do a treatment, and then we'll go back and do the other side and they can see the end result.
So if you're skeptical, if you go to one of these seminars, you can see it with your own eyes, the results right there within a matter of minutes. Do you always do them at the office?
Currently, we always do them at the office.
Okay.
We have a beautiful state-of-the-art facility. It's very comfortable, very nice, very suitable for a seminar.
Okay, so what is your contact information? If you have a website or a phone number, you can give
The
out to
website is
viewers.
www.drnowak.com, drnowak.com. Phone number 619-420-1840.
All right, perfect. Well, thank you so much for coming in. I really
Thank you.
appreciate it. Thank you very much. Best of luck to both of you. I hope continued success. And you look amazing based on your pictures. Very nice.
Thank you.
Uh-huh.
Appreciate it.
All right, we'll be back with more right after the break.